I'm Dr. George Flynn. Welcome to In-Depth TV, and today my guest, he's been requested to be on again over and over. I've got him back, Dr. Joe Santoso. Thank you very much for being here. He's a GYN oncologist.
Yes.
And would you explain to people what that is? I think they know what GYN and I think they know what oncology is, but maybe not. So explain to us what you do and how you train to do that.
Be happy to, Dr. Flynn. Thank you for inviting me over. GYN oncologists are specialists that taking care cancer in women, and mostly in the uterus, ovary, cervix, fallopian tube, peritoneal, as well as placental tumor. Also include the vulvar vaginal cancer, which are rare but could turn into cancer.
But it does not include breast cancer.
Do not.
So you're primarily pelvic
Cancer
GYN
surgeon.
cancer. Okay.
Correct. Below the belt, we call it.
Right. Okay.
And we started our training in med school, just like in any other physicians. And then we specialize in OBGYN, and then we take a special subspecialty training.
So you did you delivered babies and everything.
Used to.
Used
Long
to.
time
That's
ago.
what I mean. You did.
Yeah.
You trained to do that, and you trained GYN, just regular, GYN. And then what would be extra?
The extra are the training in cancer surgery, as well as chemotherapy, radiations, and the whole spectrum of how to treat women pelvic cancer.
Okay. So you primarily do the surgery. Do you do any of the chemotherapy?
Yes,
Okay.
we do.
You do chemotherapy, and then you help work with the radiation oncologist to
Correct.
plan the radiation.
Correct.
Well, that's a lot. That's a lot of training. How many years
And
does that take?
It's about an additional, 4 year of medical school, 4 year of OBGYN.
We're 8. Okay.
8, and then 3 to 4 more years of GYN oncology.
So 11 to 12 years.
Something like that.
Then you go into practice and retire after 5 years. Yes.
No, we enjoy doing what we do.
Well, from the time you started until now, what have been the big changes in GYN oncology therapy?
I think the last few years has been immunotherapy. You heard this over and over again.
Yeah, we've heard of it.
And recently,
And the Nobel Prize
Correct.
from MD Anderson
Correct.
went to a guy that worked with another fellow doing immunotherapy. Is that about
that's
the same?
correct.
Okay.
We know very well for many, many years that cancer eluded our immune system. Our immune system are marvelous. It could kill bacteria and anything foreign to protect our safety and our health. But cancer originate from our own cell and have been able to produce almost, you could think of it like a mask. And they wear the mask so our immune system cannot recognize them.
It doesn't
as-
recognize it as an invader,
No,
an intruder.
no.
Oh my gosh, it's kind of like in the movies, they'll have a mole on one team that's
Correct.
feeding information.
Correct.
So they're masked. How do you unmask this?
And that's where the Nobel Prize came over. The two person, one from United States and the other one from Japan, have worked very well in identifying there are molecule or protein that cancer use to mask itself, and you could develop an inhibitor or antagonist to unmask the cancer. And then when you do that, then our immune system, mostly the T cell, could kill the cancer.
So really, it's just enabling our own immune system to fight the cancer.
Correct.
Well, that is amazing. Is it? I mean, all of these things that come out in the Nobel Prize and everything, it's usually 10, 15, 20 years till it's in clinical use, or you can get it, at your local physician. When will that be available?
Oh, it's available already.
So it's available now.
Yes. So, for example, you heard about the new advancement in melanoma. Now we have much better prognosis with melanoma.
What
the
happens?
skin
What
cancer.
happens in melanoma?
Because with immunotherapy, we have some cure
Okay.
and some prolonging of life. So that's very, very
They
exciting.
used to use BCG therapy a long time
Long
ago.
time ago.
A long time ago, and it would sensitize the body to
Correct.
melanoma. Was that correct?
Correct.
See, I remember some things from medical school, but you said it's a long time ago.
Correct.
What is happening now?
Now, in what exciting in my field is taking care of women with pelvic cancer.
Mhm.
And in uterine cancer, when they have those abnormality, then we could use immunotherapy to take care of them. Now, be aware that this is not without side effect. Even immunotherapy has its own side effect.
Okay.
And what really concerning would be costs. It's become very, very expensive.
Well, we'll get to that, but go back with the other side effects, the physical side effects. Does it make you feel bad? How does this work, and what is the theory of why it makes you feel bad?
I'm not quite sure. I would think it's like bystander effect. In other words, when the immunotherapy kill the cancer, and normal cell could also be affected. So you do experience those toxicities.
Okay.
So immunotherapy is one of many other treatment that available for cancer patients.
So it's not the silver bullet.
No,
Okay.
no.
It
And-
is a bullet in the armamentarium of
Yeah.
cancer treatment.
And what interesting, although the immunotherapy just came out recently, but now we also learn that cancer becoming smarter too. And cancer now able to learn about immunotherapy and mutate, adapt to it, and put their mask back again.
Oh my gosh.
So they start developing resistance to our new immunotherapy.
So then we would have to develop something else, and
It's an endless war.
yeah, okay. But right now we're okay as far as we've got a lot going on. And if one person has a cancer, just because someone else develops immunity to this drug or this medication, it doesn't mean the person with the
No,
cancer. So
no.
it's an individual thing.
Correct. That's why we call it targeted therapy or personalized medicine. Those
Mhm.
are the keywords. But do remember though, immunotherapy is not for everybody. So you have to have specific genetic mutations that will fit to be used for specific that immunotherapy.
So it's just not like a shotgun therapy. You
No,
give everybody immunotherapy.
Yeah.
How does the cancer treat? I mean, how does every individual treat it? Is each one an individual concoction, or is it one size fits all?
one size fits all if you have the mutation.
And how do you
So
know if you have that?
We
mutation?
test you. We test your tissue or your blood or
Is
your
that a
saliva.
biopsy or?
It could be from your original tumor that
Mhm.
was removed initially. We could look for those mutations.
Okay, so you look for the mutation. If you've got it, then you're able to be treated.
Correct.
Is that related to anything in the breast cancer? We know ER positive, and that. How is all of that related?
Somewhat. The estrogen progesterone receptor in breast cancer are for hormonal therapy.
Okay,
And this is where we talk about obesity and cancer.
right.
So you try to use something anti-estrogen because we think estrogen in cancer with positive estrogen could stimulate that cancer to regrow back or grow faster.
Well, as long as you've opened the topic, we're going to talk about obesity and cancer. People people are a little bit overweight or a lot overweight. Oh, what's that got to do with cancer? That's what the general public would ask. What's that got to do with anything? Why should I lose weight? Why should I attain my ideal weight, we'll call it? What's the mechanism of that?
Yeah, we could look in several ways to explain how obesity relates to cancer. One is hormonally. When we're overweight, we produce a lot of estrogen because we have enzyme called aromatase that convert protein or hormones, other hormones, into estrogen. So that estrogen stimulate the uterus to grow, and eventually become cancer. Another mechanism that has been postulated is IGF-1, insulin growth factor 1.
Mm-hmm.
When you are overweight, you eat a lot of calories, your IGF-1 goes up. And we use those IGF-1 to stimulate cell to grow.
Mm-hmm.
And we use that when we were young, we were little, we grow up.
Mm-hmm.
Or when we are injured and we want to get wound healing, that's what we use. The IGF-1 kicked in to heal. But when you have excess of it, we think it increased risk of cancer. In some animal study, it's been shown that IGF-1 increases chemoresistance on mice or rats that have been experimented on. And I think I mentioned to you there was an interesting group, ethnic group in South America,
Right.
and that developed Laron syndrome. They have no IGF-1.
Go back to Laurent. Go back to that.
Okay,
Because some people may not have seen this,
sure.
seen that previous, and this is extremely interesting, extremely useful to you. It's not just knowledge that's out there that's nice to know. This is something you can do to help yourself. So go ahead and explain that.
Be happy to. There's a group of Jewish ethnic that isolated in South America. When they're isolated, that means they cross marriage, so
Right.
the whatever mutation they have is preserved, and the mutation they have is they don't have IGF-1 receptor. And so you could make IGF-1, but it doesn't affect them. Interestingly, they would be overweight, they would smoke, but very few of them develop cancer.
Really?
Yes.
Okay.
Now, you would say, what could I do at home
Mhm.
to learn from this Laron syndrome? The benefit. It seemed like the implication, if you reduce IGF-1 in your body, insulin growth factor 1, you would reduce your risk of developing cancer. And what's the best way to reduce IGF-1? Fasting. By just fasting for 3-4 days, you will reduce your IGF-1 by 50%. Now, that's not realistic in real life, that to fast all the time. But it seemed like some moderation in fasting probably will benefit.
How does that? How can people do that? I mean, without injuring themselves? Because everybody says, well, if you fast, you're going to get sick. You're going to do this. How would you do? Is there a protocol or a program that you can do it on a moderate basis?
I think so. I think, first of all, you need to contact your physicians, nurse practitioner, and other providers to make sure that you're safe to undergo fasting.
Mhm.
But for most people, I think eating less calorie would be beneficial to us, not only for prevention of cancer or reduction of cancer, but also for your heart,
Mhm.
your lung, your joint. When you're overweight, it's just hard on the joint, your back. We talk about, I want to kind of digress a little bit about gastroesophageal cancer.
Right.
When you have GERD, it's usually related to overweight. And you get this acid reflux that keep on going up into your
Mhm.
esophagus. At some point, it just burn that area, irritate that area, and increase your risk of developing cancer. So there's another mechanism of obesity, increased cancer. Going back into fasting, you could, first of all, moderation. Just reduce amount of calorie that we take daily. Instead of drinking soda, we drink water. That will cut down your calorie markedly. You don't have to fast, but you reduce and you
Okay.
benefit from it. The other more popular ways of fasting are called 2-5. That means you fast 2 days a week. You don't eat anything for 2 days, but you drink plenty of water.
You drink water during
Right? You
that
could
time.
alternate. Another way is called you eat whatever you want to eat within 8 hours. So it's called 8-16 system. So 16 hours you don't eat anything.
Right.
And what the thought of that is you allow the pancreas to rest rather than producing insulin all the time. Because when you and I eat, snack,
Mhm.
we continuously making the pancreas to produce insulin. And that at some point in the peripheral tissue will induces insulin resistance. So it's like a vicious
Right.
circle.
Right.
Then your
You get
pancreas
more
have to keep
insulin,
on.
more resistance, more insulin.
Correct.
Okay.
And that's called diabetes.
Right.
So
Or syndrome X is a,
correct.
when you get too much insulin, there are all kind of things that happen.
Correct. So by allowing the pancreas to rest, it seems like your peripheral cell will become more sensitive to insulin, so you will reduce the need for insulin.
All right. So we've got several options here. One is fast for 2 days, and have your regular life for 5 days, just not too many calories. It doesn't
Correct.
mean you can overeat the 5 days.
Correct. Interestingly, a study have shown if you do those fasting, the next day you can't really overcompensate in most people. For
Mhm.
some reason, you just can't eat more to compensate that fasting. So at
Mhm.
the end, you could lose weight.
So you do 2 and 5,
Mhm.
or the other one was 16 and 8,
Correct.
where you
Hours.
16 hours of not eating. Can you drink during those 16
Of course,
hours? Okay,
yes.
you can drink water.
Mhm.
Water we're talking.
Mhm.
So you can have water during those times, but you eat everything within an 8-hour time interval. And then there's another idea out there where you eat one meal a day. How does that idea come
I
up?
think it's very reasonable. It's a variation of this fasting. At the end, the goal is to reduce amount of calorie. As American, I think we eat too much salt, too much sugar, and too much fat and too much calorie.
And too much chocolate.
That could be. So I think some moderation will be beneficial for us.
So that's the first thing is cut back on your salt, on your carbs, and
Fat.
just on your fats. If you do that, then your next step would be, if you want to carry this a little further, would be the 16-hour rest and eat everything in 8 hours.
Mhm.
And if you can't do that, just cut back on everything for all your meals. Just do the best you can there. Is it the weight loss, or is it the rest of the pancreas, or what is the most significant factor in all of these ideas of not eating so much and so regularly?
I think it's multifactorial. Human species have been developed for about 200,000 years.
Mhm.
And we never have this kind of plentiful food where you could find food in every corner. In the last, most of those 200,000 years, we were in desperation for food. So our body has not adjusted yet to all this donut,
Mhm.
burger, sodas, etc. So we have to be really kind to our body.
So you're saying we have the concept of having plenty is not necessarily the best thing for us long run.
No, we have not been able to catch up with that. Our body evolved for starvations mode.
Mhm.
Now we have this plentiful, our body's still not able to handle that. And as a result, we develop various diseases, heart disease, diabetes, arthritis, back pain,
Mhm.
you name it.
Okay, you say someone out there watching has been to their physician, their healthcare provider. They say, you can go on a diet, or they recommend you going on a diet. What would you say, what would you tell your patients to do? Just cut back? Would you tell them to, because that's kind of general. If you just say cut back or eat
Mhm.
half of
Mhm.
what you're served on your plate, that's kind of general. Would you tell them to start out with the 8 and 16, or how would you tell them to start?
I tell my patients to do it slowly, because anything drastic, you're going to lose your weight, but you're going to gain it back
Mhm.
because that's not your lifestyle. If we've talked about the study in Journal of American Medical Association at which they compare Atkins diet versus Weight Watcher, etc., etc., and everybody lose weight.
They all
But-
work. They all work.
They all
Yeah.
work if you stick with it.
Mhm.
But then, interestingly, on that study, when you follow, and everybody gain weight again. Why? Because it's not natural. It's just hard for them to keep on eating meat or whatever that diet is. That's not what we used to. So my recommendation is do gradual changes and then change your lifestyle. Then the weight will follow and stay lost permanently. First, to be concrete, I would advise my patients to just drink water. Stop that sweet tea, juices, sodas, those alcohol.
I knew you were going to get to all of the
Sorry.
things.
They may taste good because we didn't have that in the last 200,000. So we price that, we value that very much.
Right.
Now we're eating in excess. So stop the drink and
Go to water.
go to water.
First thing to do, drink water. And how much water?
Your body is very smart. drink whatever that your body says. I'm thirsty. I want to drink.
So drink water, and then when you do eat, would you say eat more protein?
I think that's the next step. The next step, we learn that carb is dangerous to our health. It converted directly into sugar and then converted to fat. So I would moderate amount of carb and then increase lean protein. And what are
Okay.
lean protein? Fish, chicken, turkey, and please don't fry it.
Don't fry it. No fried
with
chicken.
grilled,
Grilled
baked.
chicken
Correct.
and baked chicken.
Correct. And then adjust it to your lifestyle. So don't do things too drastically because it's going to be a yo-yo type of weight loss.
Your body basically is a homeostatic mechanism. It likes to keep things steady. It likes to keep things on a even plane. Your body does not like big changes. So exactly what you're saying goes along with what most people know is make gradual changes for permanency.
Correct.
Because if you make a change and things go well for a day and a half, and then you all of a sudden don't feel so good, say, "Oh, the heck with it! I'm going back to my regular diet." Make change. First one: drink water, no sugary things, no sugar or tea. What would you say? Because I'm on the audience side now. We're bargaining with you. What would you say about coffee or about tea without sweetener?
I think if you like to have some of those, go for it in moderation. I personally stopped drinking coffee and tea a while ago because I just realized I enjoy water now.
Okay, but it puts a taste to it. And so I would say, just personally, I wouldn't use the artificial powders that you put in water to make them taste
I
differently.
agree.
The artificial sugars, and it's just something about it.
If you stop all those sweet or salty drink, you will realize that your receptor in your tongue become more sensitive. So you could practically taste the sweetness of water.
Okay.
So
How long does that take you to occur? How long did
that
that
takes
take?
me a few months.
So a few months.
Yeah.
So don't be worried if you don't, if you drink water and you say, I don't know, I'd rather have a Coke, or I'd rather have a Pepsi, or I don't want to get product specific here. But what about diet drinks?
I don't recommend it because again, there's no free lunch. When you use that sweetener that has no calorie, your brain get confused, and your brain says, "How come it's sweet but there's no calorie?" And there are some studies suggest that you increase your appetite, you ended up eating more.
You do. What happens to your insulin levels if you have something artificially sweet in your tongue? Doesn't it raise your insulin levels?
I'm not sure on
I'm
that
not
part.
either.
I'm
But
not sure.
I've heard that even when you first taste it, that your insulin level, your pancreas will say, "Here it comes," and
Correct.
and give you some insulin.
Anticipation, maybe. This is interesting. I have a few patients that say, "Dr. Santoso, I do not like water. I hate water. I have
Here
to
I
drink
am.
soda."
Here I am.
So, and then interestingly, I take some of these patients for surgery. So before surgery, you cannot drink any water for 6 to
Really?
10 hours. Interestingly, the morning of that surgery, they were begging for water. They says, "Dr. Santoso, I'll do anything if I
Just-
can get water."
Just give me some
So,
water.
in other words, it's perspective. Don't take water for granted.
Okay.
It's a
And-
very, very
And
valuable.
you just have to stick with it. Now let's get really concrete, because we've thrown out a lot of generalities here. Let's get really concrete. All right, someone out there, you may be watching. I know who you are. You're saying, well, how do I start this increased water? I'm saying, if you have to do it one meal for 2 or 3 days. Then do it 2 meals for 2 or 3 days. And then of course you want to get to the entire, every time you drink something, it's water. But right in the beginning, just like we were talking about, you can cheat a little bit.
Mhm.
But don't make cheating a habit.
Mhm.
There's a way to gradually get into this. And you're in for a healthy lifestyle. And that's what he's been talking about. So let's do this. We can do it gradually, and we can do it where the body doesn't revolt on us and say, no, we're not doing this. What other ideas are coming up in medicine? What does the future hold for us? As far as chemotherapy, as far as immunotherapy, as far as new diagnostic things, what do you see in the future?
I think if let's go about treatment. Cancer is genetic disease. The problem is with the DNA. It
Right.
mutated, it become out of control. So various treatment are to repair or to take care of that damaged DNA. In the past, we have a very sledgehammer type of treatment, radiation, surgery, chemotherapy. That's like you give it to everybody.
Right.
Hit a lot of
Mhm.
tissue, whether it's normal or not normal tissue. And that's why the side effects are pretty significant. We're hoping for the immunotherapy to become more specific.
Right.
I've seen some, but in my early experience taking care of patients with immunotherapy, I see some side effect that still pretty significant. So that's not the solution that we see. So we still have a lot to learn. Cancer is smarter than we thought. I think in 1970, Nixon declared war against cancer. We make tremendous amount of progress, but we haven't conquered it. So I'm looking into not only just treatment, but also encourage my patients to prevent it. And majority of them could be prevented.
Well, in a couple of minutes here, what can someone do to help prevent it besides lose weight?
Sure.
Lose weight.
Sure. Smoking.
Smoking.
My gosh, that's a big one.
Okay.
You quit smoking,
Well, smoking's got to do with lung cancer, though.
Lung cancer and other cancer.
I knew you were going to get to that.
Yeah.
What other cancers do?
In cervical cancer, we learned that when you smoke, cervical cancer is the woman cancer in next to the womb.
Right.
We learned that it reduces your immune system in the cervix. And when you smoke, precancerous lesions goes into cancer more aggressively and more quickly. And then when you smoke, radiation therapy doesn't work as well.
Right.
So quit smoking.
Stop smoking.
Lose weight.
Drink water.
Drink water.
It's things we learned in kindergarten, and we just not doing them.
Correct.
And if you'll just do some of these things, begin with whichever one you want to begin with, but just start with something to improve your health.
You lose weight, you reduce your risk of uterine cancer. Vaccination. We have new indications now. FDA just expand the HPV up to age 45.
Okay.
This has just come out, I think, a day or two ago. So now you could get from age very early, like 9 years old, to 45 to get HPV vaccine.
So you should, if you're 45, do you still get it if you've had HPV, or do you know?
Well, we think you still benefit, but not as effectively as you never had been exposed to HPV.
So up to age 45, HPV vaccine will probably benefit you.
Correct.
That's great. I really appreciate you being here with us today, and we've covered so many topics. I'm sure we're going to get a lot of questions, and we'll have a little email address where you can send your questions. And when Dr. Santoso's coming back, and see, I've already gotten him coming back, he will answer those questions for you. I'm Dr. George Flynn. You've been watching In-Depth TV. Thank you for watching. We'll see you next time.